Well, good evening. I'm Kristina Johnson, President of The Ohio State University, and welcome to tonight's event, which is the first in a series of virtual town halls focused on COVID-19. They'll take place on the first Monday of each month through at least April. Thank you all for being here, and thank you all those who helped organize and plan these events. I know it takes a tremendous amount of teamwork and collaboration, and a special thanks to everyone who's participating. I look forward to hearing your thoughts later this evening. As you've all seen in emails and on social media, Together as Buckeyes has been our campus motto for the past year. And it serves as a reminder that even as we continue to face many challenges in this pandemic, we're still all in this together. We don't, however, just want it to be a stock expression we use in place of constructive information. It's both a reminder and a call to action, which is one of the reasons why we're holding these events, so we can share everything that we know and learn. So tonight's town hall is specifically focused on the COVID-19 vaccine. We know that many of you have questions about its distribution and availability. We've brought together experts to help answer some of those questions. Before we start, a bit of more positive news. We've come a long way since we started back to campus last fall with face-to-face instruction. At this same time, in the fall semester, August 31, I know that because it was the day before I started officially as your president, we saw our on-campus positivity rate spike to nearly 6%, and our off-campus positivity rate as high as 9.3%. To date this spring, the 7-day average positivity rate for all students is 0.8%. On-campus average is 0.55%, and the off-campus average is 0.95%. This is phenomenal. It means that we've learned from some of the things that we did in the fall, and that you have been so helpful in carrying them out, and we deeply appreciate that because you're helping keep Buckeyes Together safe. The health and safety of our university community will always be our top priority, so we thank you for doing your part to help achieve those goals. We're committed to keeping you informed with the most up-to-date information about COVID-19, which we'll continue to make available on the Safe and Healthy Buckeyes website. We'll continue to share regular updates with the campus community. While vaccine supply remains low, production is ramping up. The prioritization of the distribution of the vaccines is set by the state of Ohio under guidelines established by the Centers for Disease Control and Prevention. While we don't have a specific timeline for when vaccines will be widely available, the university is actively planning for expanded vaccine distribution as allowed by the state of Ohio. Although this progress is promising, it remains critically important to keep following public health protocols even if you receive the vaccine, which means continue to wear masks, practice physical distancing, avoid large gatherings, and consistently wash your hands and keep them away from your face. We do these things to keep each other, ourselves, and our community safe because we are in this together as Buckeyes. I'm thrilled to have students back on campus for their second week of in-person classes and fourth week overall. Thank you for your collective efforts to have a safe and healthy spring semester. Now I'll introduce our distinguished speakers for the first COVID-19 town hall. Dr. Bruce McPheron, the university's Executive Vice President and Provost. Dr. Hal Paz, Executive Vice President and Chancellor for Health Affairs and Chief Executive Officer of the Wexner Medical Center. And Dr. Andy Thomas, Senior Associate Vice President for Health Sciences and Chief Clinical Officer at the Medical Center, at the Wexner Medical Center. We are delighted and honored to introduce the moderator for this evening, Dr. Teresa Long, former Columbus Public Health Commissioner and Special Advisor on Community Engagement to the College of Public Health. We're also very pleased that several of our experts from across the university are here to answer your questions later on. Special thanks to Dr. Morley Stone, Dr. Amy Fairchild, Dr. Melissa Shivers, Mr. Paul Patton, and Dr. Peter Moeller for their participation. And lastly, I'll turn the program over to Provost McPheron. Bruce?
Thank you, President Johnson. We're focused tonight on vaccines, but I also want to acknowledge the incredible work that's allowed us to navigate the pandemic over this past year. Everyone, students, faculty, and staff, has adapted how they live, work, and interact to support one another. This is the essence of Together as Buckeyes spirit, and it remains strong today as we enter the fourth week of spring semester. While we've seen enormous change, teaching and learning, research and creative inquiry, and outreach are all continuing because we're taking the steps necessary to keep each other safe and healthy. Thank you for continuing to wear masks, maintaining physical distancing, avoiding large gatherings, and following all our other public health guidance. By doing so, we've minimized the spread of COVID-19. Dr. Paz and Dr. Thomas will lay out more information about the COVID vaccines, but let me assure you that we are focused on making sure that students, faculty, and staff have access to the vaccines when they are eligible based on the state's guidelines. We know that universities around the country are handling vaccine distribution differently, but this is largely the result of each state's distribution plan. There's a limited supply of vaccine, requiring the state to make hard decisions about prioritizing different portions of the population. But within that guidance, we continue to advocate for our Buckeye community members to be included as soon as is practical with the state's plan. Let me turn things over now to Dr. Paz to provide more details about the vaccine. Hal?
Yes, thank you. Thank you very much, President Johnson and Bruce. Good evening to everyone. So although this is yet another virtual meeting, I'm grateful to have the opportunity to be here with you this evening and hopeful that we are truly nearing a time when we can be together again in person. And I believe that the progress that we're making in our COVID-19 response shows that we are moving closer to that day. One of the biggest reasons for that is the rollout of the COVID-19 vaccination program that started in mid-December. But with even more than 25 million people in the United States receiving the vaccine, we know that many more people still have questions about its efficacy and safety. A December Kaiser Family Foundation survey found that 27% of Americans still are hesitant to get the vaccine because they worry about possible side effects and vaccine safety. And that doesn't take into account understandably higher rates of hesitancy and fear among communities of color, even though they've been hit hardest by the pandemic. But of more than 1,300 medical center employees surveyed, 82% said they enthusiastically want to receive this vaccine. And I believe that's because as a scientific community, we have trust in the data and in science. So what do we know about the vaccine? Worldwide, there are 20 vaccines in development. 2 vaccines, Pfizer and Mrna, are currently authorized in the United States. 2 others, AstraZeneca and Novavax, are in phase 3 clinical trials. And Johnson & Johnson subsidiary Janssen announced last week that they expect to seek emergency use authorization and release for their single-dose vaccine this month, February. All this is happening as part of Operation Warp Speed, which is a term that many of us are now familiar with, but it's also a bit of a misnomer. And that's actually the most common concern we hear. People are afraid that the vaccines have been rushed into production. But while warp speed does mean that we've worked quickly to make these COVID-19 vaccines available, it does not mean that the safety or efficacy was compromised in any way whatsoever. In fact, much of the science behind COVID-19 vaccines have been studied for decades. It's now only the application to the SARS-CoV-2 virus that causes this COVID-19 vaccine to be new. And you can learn a lot more about COVID-19 vaccines on the Safe and Healthy Buckeyes website, as well as the Ohio State Wexner Medical Center website that we're going to share a few highlights with you tonight. So there are a few different vaccine types. You're probably most familiar with the messenger RNA or mRNA type, because that's both of what Pfizer and Mrna vaccines use. And we'll come back to that in a minute. Vaccines like Johnson & Johnson and AstraZeneca use what's called a viral vector technology. And that simply means that it uses a modified or harmless version of a different virus, in this case, an adenovirus, to carry the SARS-CoV-2 proteins into the body and to cause an immune reaction. This is the kind of virus that's been used now, the kind of vaccine that's been used now for Ebola. And then finally, there are what are called protein subunit vaccines like Novavax, which use a harmless piece of protein from the SARS-CoV-2 virus to drive the body's immune response to those proteins. And we use those as well currently. The hepatitis B vaccine and even the pneumococcal vaccine for strep are the kind of vaccines that use this type of technology. So, as I mentioned, there are currently 2 COVID-19 vaccines currently being administered, and both are called mRNA vaccines. mRNA technology has also been studied for decades for other viruses, such as the flu, rabies, Zika, as well as in clinical trials for cancer. So, slide 1, which you should be seeing in front of you. How does the SARS-CoV virus know or how do we respond to the SARS-CoV virus as a result of this vaccine? It's very simple. On the virus, and everyone has seen pictures of this, is a spike protein. The spikes allow RNA to enter the body to reproduce inside healthy cells and then to cause all the untoward effects of this virus. So when the virus enters the body, your immune system should in fact be creating antibodies to fight it off. But since the COVID-19 is caused by a new virus, a novel virus, our immune systems don't recognize it and we're not prepared to fight it off. What's beautiful about the mRNA vaccine is that it's made with the genetic code of that virus spike on the outside of the virus. And so when it's administered, the mRNA enters your body's cells, it introduces itself in order to stimulate an immune reaction and begin creating antibodies. If the real virus then enters your body, your immune system will now not only recognize the virus, but it's also trained to fight it off. So it's important to note that the mRNA does not enter the nucleus of any cell where our DNA is located or affect genetic material in our body. There are no live viruses in the vaccine, so you can't catch COVID from the vaccine. Regardless of the type of vaccine you receive, there can only truly be effective if, when we're vaccinated, enough of us receive an immune reaction, immune response, so that we as a nation, as a community, achieve herd immunity. Based on a number of factors, including limited supply, which I know Andy Thomas will be sharing in a few minutes more about, we are still far from reaching herd immunity. It's commonly estimated that for a community to have immunity to this virus, or any other for that matter, about 70% of the population has to be either vaccinated or the population needs to have been infected. And frankly, that's why it's so very important that we continue to rely on safety protocols to help reduce the spread of the virus. And the simplest way that we can do that is to wear a mask. The science is absolutely clear. Masks lower the risk of COVID-19 infection by as much as 80%. That means lives saved. So these masks not only protect others in case we're carrying the virus and stops the spread from leaving us and going to others, it also, by wearing a mask, protects us from being exposed to the virus. And as you heard from President Johnson, we can even do more to prevent the spread and prevent deaths by continuing to practice physical distancing, avoiding traveling and gathering in groups, and washing hands regularly. So I'd like to close by saying thank you to all of you. I am so grateful to all of you for being diligent about keeping yourselves and each other safe and healthy as possible. And during these challenging times, we know that all these different steps that we can take as individuals, including getting vaccinated when it's our time, will get us through together. And with that, it's my pleasure to turn it over to Dr. Andy Thomas.
Thank you, Dr. Paz. I appreciate those comments and the opportunity to be here tonight. Thanks to the university for putting this together and for all of you who are attending. It's amazing to think it's been a little over a year. It was January 22nd of 2020 when we had our first meeting about the coronavirus. It was the day after they had announced the first case in Seattle. Probably many of you remember that day. We had over 80 people from across the university on the phone. Everything from a variety of clinical departments within the medical center to student health, to student life, to the Office of International Education, to the athletic department. And really from day one, the team pulled together. It's the same team that's been together through a variety of other similar situations like mumps, like Ebola, like Zika, even hepatitis A outbreaks. And we pulled together to really partner on behalf of the university and our community, since we are in and of ourselves a small city compared to a lot of other areas of the state. So it's amazing. It's been a year. There's a lot of things that have happened, a lot of real positives on the research and the clinical side. And I also want to take a moment just to thank all of my colleagues at the Medical Center and folks really from across the university for their commitment to safety and excellence in patient care, excellence in research, as we've really tried to drive innovations here. But what we're here to talk about tonight is vaccines. And I think for many of us who've been at the front line of this over the last year, it's really been over the last 6 to 8 weeks where we've really felt like we're kind of at maybe at least the end of the beginning, if not the beginning of the end of this pandemic because of vaccines. I'm going to spend a few minutes talking about the state of vaccines in the state of Ohio, and then a little bit about Ohio State and how we're approaching our vaccination efforts. What you see on the screen right now is a dashboard that's publicly available on the Ohio Department of Health website. You can see it's a bit of a long link there, but if you just type in COVID-19 vaccine dashboard Ohio, it will come up. And what it is a color-coded map by county of the percent penetrance of the percent of residents of that county that have been vaccinated. They have the data broken out by age, by gender, by race, by ethnicity. And you can search either by daily counts or cumulative counts. As you can see, this is actually data through Saturday. When I submitted my slides, it was still at 823,000. The data today through yesterday is at 853,000. The state's doing a little over 150,000 first dose vaccines per week. So the good news is, I think as we're sitting here next week, we'll have crossed the 1 million mark. Now that's out of 11.5 million citizens in the state of Ohio. But as you can see at the bottom, that 80 and greater age group is at 46% of those folks have been vaccinated. And that's, like I said, through Saturday. Except for people that live in a nursing facility, those folks that are age 80 and greater have only been eligible to be vaccinated for the past 2 weeks. So making a lot of progress in those high-risk groups. But this is data, if you're interested, you can follow literally on a daily basis. It's updated. Next slide. This is also a little information about where you can get the COVID vaccine in the state of Ohio. On the left is the entire state. Each one of those dots represents a location where the vaccine is available. That includes hospitals, includes local and county health departments, also includes many retail pharmacies. If you look, for example, on the right half of the slide, there are over 90 locations in Franklin County alone where you can get the coronavirus vaccine. Many of those are our local Kroger pharmacy, our local Giant Eagle pharmacy. And the state has a website. You can type in your zip code, or you can type in by county, depending on where you live, and find the closest location near you, as well as a website and a phone number to call to schedule. So the good news is there are over 1,000 current active sites in the state providing the coronavirus vaccine. There are another 1,000 sites that have applied to be a vaccine administration site, but the supply of doses in the state right now is not high enough to go more than 1,000 sites. But they are looking, as we expand, as Dr. Paz was just going through additional vaccine options, which we hope will be on the market here in the next month. As the supply increases across time, they expect to have over 2,000 different sites in the state where you can get the vaccine. Next slide. So a little bit about how we've approached this here at Ohio State. On December 14th, we received our first set of vaccines, and we received 975 doses of Pfizer and had it in people's arms within a couple hours that day as our first test day for vaccinations. We used, for the first month, we used 3 different sites, one at our Ackerman Administrative Campus, one on our East Campus, and one at the Biomedical Research Tower here on main Columbus campus. For the 1A vaccination period, which was mainly our staff. We realized quite quickly that was not those sites were great for our staff, but were not going to be terrific from a patient-facing perspective. And we knew we'd be pivoting at some point in January to patients that, in this case, many are very elderly, and those sites were not going to work. So we worked very closely with the athletic department. I want to send out a big thank you to Colin and Scott and Evan and the team at the Schottenstein Center, Zen, Riggs, and Gene Smith, especially, who were instrumental in getting this moving forward. We opened with a Part Day Vaccination Day on the 15th and then opened fully on the 19th and really have had a lot of success at the Schottenstein Center. Next slide. I'll go through some data in a second about where we are with vaccines we've administered, but I want to touch briefly on where we are with the rules that the Ohio Department of Health have put forward in terms of who's eligible for the vaccine. So 1A was the first group, and that was that December through mid-January timeframe. The state defined really three different groups in 1A. First, in the state from the beginning has tried to take a harm reduction approach to how it has distributed vaccines. Nursing home residents or nursing facility residents that are oftentimes in difficult health situations or are elderly are seen as amongst the highest risk for serious COVID disease and death. In fact, almost half of the mortalities in the state of Ohio since the beginning of the pandemic have been from nursing facility residents. So one of the state's highest priorities were nursing facilities and their staff to vaccinate. Second were EMS workers, individuals that were responding to ill calls in people's homes. Obviously, there are emergency or urgent calls. They don't have time to stop and test someone for COVID, et cetera. So there were EMS workers were a high priority. And then hospital staff, knowing that hospital staff were caring for not just the sick COVID patients, but for everyone else, all of the heart attacks, strokes, traumas, cancer patients. If our healthcare workers were not there to provide that safety net of care, there were going to be significant problems across the state. So the group initially that was chosen to be vaccinated in 1A were those three focused populations. The state did announce on January 15th that they wanted to bring 1A to a close on January 17th. So we had a large number of invitations that were out for people to sign up to be vaccinated. When the state changed and decided to close 1A, we did send a message out to individuals that they needed to get signed up by that Sunday at midnight, or else they would lose their opportunity to be vaccinated. That was a difficult decision to make, but I think the state felt very strongly we needed to pivot to 1B. And we knew at some point we needed to pivot to 1B as well. So we did have a large number of individuals that got signed up before the 17th, but we did have an issue with that. And many of you have heard about this since last week. The state's expectation was that we would have all those 1A individuals vaccinated by the 23rd. And it was a problem on the scheduling side that many of the people, even though they had gone into the system to schedule an appointment before the 17th, their appointments got scheduled after the 23rd. When we found out in the middle of last week that we had blown through the state's deadline of having 1A vaccinations done by the 23rd, we immediately responded, canceled the 1A vaccinations that were on the books from noon on Wednesday through the end of who we had signed up for our staff. I want to be, and I've done this in a number of different forums over the past week, just to offer anyone who's on this webinar who is impacted by the situation to offer you my personal apology. Our team has done a lot of the right things as we've rolled out the vaccine, but this is one that clearly I missed the ball on in terms of that part of the state's policy. Our team was not focused on ensuring that our staff were scheduled in before the 23rd. And when we found out we had made a mistake, we did our best as quickly as possible to rectify that from the state's perspective. We continue to work with the state to try and get those individuals who had visits scheduled but needed to be canceled to get a number of those individuals vaccinated. We continue discussions with the state about how to do that. For those individuals on our staff who have gotten their first dose, we are continuing with second dose vaccinations in the 1A group, and that's actually going quite well. To pivot quickly to Group 1B vaccinations that are now underway, there are once again a number of groups that the state has chosen to highlight from a harm reduction perspective. So the first two groups are about harm reduction to the individual's health in terms of their risk for severe disease or their risk of death. So the state has taken an approach of looking at elderly patient populations above age 65 as the highest risk for mortality. Once again, it's really it's been a longstanding sentiment with COVID that your risk of dying from COVID are your health risks when you meet COVID, right? So it's people who have a lot of underlying health conditions or who are elderly that are highest risk of severe disease or death. So the state has taken an incremental approach initially with those over age 80, then 75 to 79. Just effective today, those age 70 to 74 are able to be vaccinated. And next Monday, those 65 to 69 will be eligible to be vaccinated. So once again, the harm reduction approach of focusing on the elderly, but also focusing on those who are disabled with congenital and other severe neurologic disabilities, as well as a variety of really high-risk health conditions, things like sickle cell disease, thalassemia, diabetes that's required hospitalization in the past year, congenital heart disease. So those would be individuals under 65 that currently, as of February 1st, meet that definition, both disabled as well as with a high-risk disease. And then after February 15th, it will be either or, people that are either disabled or one of these high-risk diseases that have been defined by the state. Once again, with the hope that we will reduce the risk of severe disease and death amongst those populations. The third group that the state's chosen in 1B are K through 12 teachers. And that's a little different harm reduction approach. That relates to the fact that there are many school districts, especially in urban areas, where K through 12 students have not been in school for now going on nearly a year. As many of you remember, much like we started to go virtual in March last year, if you don't have children that are in K through 12 education, that's when the schools in the state mainly went virtual. Some have never returned. And the state has a commitment because of the not just physical health, but emotional and psychological health, and certainly the academic health of those K through 12 students to try and get every school district in the state back into the classroom this spring. So the state has gotten a commitment from those school districts that have not been in person that they will be doing in-person education this spring. And then just today, they began offering vaccinations to K through 12 teachers and staff that are student facing. So for large districts where they may have some staff that don't see students, those staff are not supposed to be eligible for vaccination. But student facing staff, that could be bus drivers, it could be teachers, it could be anyone in the school exposed to students would have the opportunity to be vaccinated. And that will be completed over the next few weeks. Next slide. So a little bit just for those of you who do have the opportunity to schedule, either because of your age or as we move forward through the different different groups in the future, there are a variety of ways with Ohio State that you're able to schedule. So as you become eligible, if you have an OSU MyChart account, we will be flagging that in your chart. So you'll actually be able to check, see an appointment, kind of an invite for an appointment in MyChart and go be able to go in and schedule. There are also Televox automated outgoing phone calls, especially as we've gone down through the age groups where we're sending out messages to people, notifying them that they're eligible, and notifying them if we actually have enough vaccine supply. OSU provider offices can also schedule. We've given tip sheets to all of our provider offices to allow them to schedule. So primary care docs, specialty providers, nurse practitioners their offices can schedule these for you if you're an established patient. And last but certainly not least, we developed a hotline, 614-688-VAX. That allows us to schedule both established patients if they call that option, but also patients that are not established patients of Ohio State. We had a local health system in town that needed to cancel a number of vaccinations because they actually ran out of vaccine unexpectedly. And we had over 500 patients that are in that 75 to 79 age group calling us on Friday and Saturday to schedule. And these were patients who had never been to Ohio State before. So that Vax line is a good way for people to engage and try and schedule. Next slide. I'll finish with this, just some data on what we've done. This is data through yesterday. As you can see at the top, this is in aggregate, the public doses as well as the first doses. In terms of total vaccinations completed, first and second doses, we today crossed 30,000 doses. In fact, if you look just at the number of doses delivered since we've been at the Schottenstein Center, we're doing the final count. In fact, they're still vaccinating over there for another hour today. We'll do the final count. We think we surpassed the actual seating capacity of the Schottenstein Center arena today with shots that have been delivered at the Schottenstein Center. If you look down in the middle of the chart there, or the middle of the table, are our staff and students who have been vaccinated. So we've had 16,373 individuals complete their first dose through yesterday. And then about 31% of those folks have actually also completed their second dose. So once again, moving forward through this process of 3 weeks for your second dose of Pfizer and 4 weeks for your second dose of Moderna. And then at the bottom, where I think we're most proud is what we've been able to do for the public. We're now, today we'll have most likely crossed 9,000 public doses of vaccine that have been delivered. And as you can see, we have another over 3,000 individuals that have signed up. And we've averaged well over 700 patients, public patients for first dose vaccines each of the days that we've been open at the Schottenstein Center. So with that, I will pause and we'll move into our Q&A. I believe Teresa Long, you'll be picking it up from here.
Hi, and good evening. Thanks so much, Dr. Thomas, Andy. And thank you to each of our speakers, President Johnson, Dr. McPheron, Dr. Paz, and again, Dr. Thomas. Thanks for sharing this information. I think it's really useful to all of us to hear some good information up front, and now our intent is to really answer more questions that have been coming in. Some obviously were submitted early, but thank you for submitting those. So to everyone who's here, welcome. I'm very glad you're here this evening. And please take a look down in the Q&A. You have it right below you. If you have questions or comments, please use that for the Q&A function because they will be submitted. I've actually been seeing some of them come through, but I've got some colleagues who are curating those. So we will try and get to as many of those as we can. But honestly, you have been a very engaged community, so we have lots and lots of questions to consider during tonight's conversation. I would want to mention that the university will be posting the responses to these questions, to the frequently asked questions by topic. They will be placed on the Safe and Healthy Buckeye website. And when those are ready, there will be, you will be informed of that through the on-campus, that there are new questions and answers, FAQs on the Safe and Healthy Buckeye website. So before I begin with the questions, and again, thank you so much for being here and for sending in questions both before and during this. I just wanted to share a quick comment, if you'll allow me. This has been an amazing year, a challenging year, just remarkable. And we are all so eager to move forward. The promise of these COVID vaccines really elicits a variety of responses as we all look forward to a future that feels better, feels different, feels more usual perhaps, where we're more connected in person. So again, there's a lot of excitement in the air. And yet at the same time, right now, as has been said, it is so important that we both individually, but work together as a university community to address both the questions that you have, to share information, in this case about vaccines. We need to understand, now that we have vaccines available, the science behind the vaccines. And again, we've heard some very good information already tonight about that. We need to understand the distribution plans. And again, that we've already heard some about, but questions are already being posed on those. And as fatigued as we all are, we really need to also recommit to the safety measures that we must keep up going during this time. So again, thank you for your engagement on this, and with the volume of questions that we've had submitted, I'm going to get us started to cover some of the topics that were of the greatest interest. And we had many, many questions about some of these topics. So here we go. Dr. Thomas, you're first up. How about this? When will the broad population of the Ohio State University faculty, staff, and students get the vaccine?
Thanks for the question, Teresa. It's a great question. I get it all the time, not just from colleagues at the university. I get that from my neighbors. I get it from my 13-year-old at home who's interested in getting vaccinated. I think it's a difficult question to answer, partly because we don't really know the exact timing for additional manufacturers to come online with new vaccines. There's also a bit of a game changer if the J&J vaccine is approved for a single dose. That obviously changes the number of people you can completely vaccinate with the same number of doses. A couple things I will share though in terms of stats. So just thinking about in Ohio, for the non-institutionalized individuals over age 80, there are over 400,000 of them living in the state of Ohio. Ohio currently is getting just over 100,000 doses, first doses per week for vaccination. So thinking about just getting through 1B, because the groups, as you can imagine, as you go down to folks 70 to 74 and 65 to 69, there's more people than there are in the 75 to 79 group, for example. So that group continues to grow at a time we're still only getting 100,000 doses a week. And with moving to K through 12 teachers this week being vaccinated, that's taking some of the supply as well. So we think as an estimate, it's probably at least 3 months to get through group 1B. So we're probably looking at the end of April, maybe, before we're even through the elderly population. And that, of course, depends. If 2 more manufacturers were on the market 2 or 3 weeks from now, that date may change. If they don't get approved, that date might not change. So it's a little hard to say. And then I think the next question is, where will the state go after 1B? Will there be a 1C that has other groups of essential workers? Will there be a group 1C that maybe goes from age 50 to 65 or 50 to 64? That decision has not been made yet. There are a variety of, you can imagine, ideas on the table. I think right now the state's trying to get through the phase we're in and do it well. And then we'll be turning their attention to where to go in a group 1C after that. I think the eventual goal, Teresa, would be that this will become as ubiquitous as the flu shot. As I showed earlier, there are over 1,000 sites now in the state where you can get it. There'll be probably over 2,000 as we get more supply. So I think it may be just as easy to get it at the CVS down the street from your house or from your advanced practice nurse that you see or your physician that you see as it will be in a mass vaccination site like the Schottenstein Center. Now, we have committed, and the athletic department's committed to do that through the end of April. We planned 100 days of vaccination at the Schottenstein Center site. We won't know probably till April 1st whether we'll be extending that or whether the situation's going to change. So I think that that's a long answer to a short question, but the short answer is we don't know, but that's my best guess of how that might play out.
Thanks, Andy. And actually, I think that's probably the number one question that I get. And obviously, it's the number one question that's been coming in both live, but also that we had submitted ahead of time. So thank you for that. And actually, in that same vein, and to follow up on that, I'm wondering, President Johnson, if you would want or be willing to say something about how Ohio State and what we're as a university is doing to help ensure, again, that students and faculty and staff receive the vaccine.
Yeah, absolutely. Thank you very much. Appreciate it, Teresa. Well, first of all, safety is our number one priority. And I just want to thank all the members on this panel and also all the team members that are here to answer your questions, and we'll answer them even if it goes beyond 6:30. We've been meeting at least 3 times a week. We started out meeting every day at 8 a.m. to talk about how do we scale the testing, the tracing, and now the vaccination of our faculty, students, and staff. We've been in close coordination and collaboration with the state governor's office, Governor DeWine, as well as local and state health experts. So we're monitoring this very carefully and working together to bring everything we have as Buckeyes to help get the vaccine out as quickly as possible as it becomes available. So, I think that there are 2 things that we stood up that took our ability to test, trace, and vaccinate to scale. One is Jesse Owen North, phenomenal achievement. The other is the Schottenstein. Kind of ironic, get your shot at the Schottenstein, as we all know, but that's something we talk about every single day.
Well, President Johnson, thank you. That's really reassuring. And actually, just while you were speaking, I got a text from an older neighbor who just came back from the Schottenstein getting her shots at So
that's great.
Great. That's real time for you. So thank you. And again, it's very reassuring to hear all that's being done to assure that we all get our vaccine as soon as we are able and eligible. So thank you. So, Dr. McPheron, this one is for you. Multiple people have been asking, not surprising, will Ohio State prioritize faculty who are teaching in person to receive the vaccine?
A great question, and I'll start by reiterating what we have heard earlier. Dr. Thomas just talked about the fact that we're operating under the guidelines of the Centers for Disease Control and Prevention and the state of Ohio. And so we do have to follow their guidance. We know that other states have a different cadence of bringing people into priority for vaccination. And so it's something that's very much on our mind. And what President Johnson just said is exactly true. We're in close conversations with a lot of folks who are making these decisions, so that when we have the opportunity to say, here are some of our priorities, we make the case. It's a set of hard decisions that are being made right now, and there's just no denying that we're not going to be able to solve every problem until we move a little further along. In the interim, I'll just reiterate something that we've said several times already this evening, and that is we're paying incredibly close attention to continuing to enforce masking, physical distancing, all of the different public health components that have been so important. President Johnson opened the session tonight with remarks about the change from a semester ago to now in terms of what we think this education and compliance by our Buckeye community is actually doing for us. It's having a real effect. And so, we will continue to employ all of those different mechanisms, while at the same time doing everything that we possibly can to make sure people understand the prioritization as we would put it forward. And I would say, we think about this, certainly faculty, but graduate teaching assistants are doing a lot of face-to-face instruction. So we're thinking about all of those communities as we move forward. Bottom line, we're in the state of Ohio and we're following their guidance, and we do everything we can to appropriately influence the prioritization. But our number one priority is moving through the system with our partners at the state.
Great. Well, I appreciate that. And I know that many will appreciate hearing, again, Dr. McPheron, that the university is doing everything it can to move this forward. So Dr. Paz, and thank you also for being with us. When it's more widely available, should faculty, staff, and students expect to be vaccinated through Ohio State? I think Dr. Thomas spoke to this, but again, there are questions about, again, reiterated in the Q&A about how I'm going to hear, and must I or should I be receiving through Ohio State as a provider?
So that's a great question, Teresa. It's like the flu vaccine. We expect that eventually you'll be able to receive the vaccine for COVID-19 through a variety of different providers. It could be a hospital setting like at the Wexner Medical Center, but certainly also retail pharmacies, health departments, and even depending on your health insurance, it will determine where you might wind up receiving your vaccine. Your medical provider, the location that you live, the part of the state of Ohio you're in, all these will have an impact ultimately on where individuals will receive the vaccine. That being said, at the Wexner Medical Center, we're fully committed to making sure that we can continue to be a provider of the vaccine. And we're going to work with the state, and we're going to work with the local health departments to ensure that going forward, our faculty, our students, and staff have access to vaccinations. But we also want to respect individual medical care and the relationships that everyone has with their providers. And we want to make sure that as the vaccines are rolled out, that type of choice is available to them.
That's really great. And actually, one thing that I would reiterate as people are choosing, be sure that you get a vaccine card so you know exactly what you got, because you might shift to a different location, but you really need to keep going with the same product and potentially the same provider, but certainly the same product. So thank you, Dr. Paz, for that. That's really helpful. And we've continued to have questions. And actually, Dr. Thomas, back to you, Andy. Because here's one that, again, you've addressed, but I think we're seeing more questions about this. The Centers for Disease Control and Prevention, CDC, has listed those who work in the educational sector as phase 1B. You've spoken to this, but doesn't that include higher education? And what does that mean for us in Ohio?
Thanks for the question. I do get that question a lot because the CDC also includes a lot of other workers in that definition, including agriculture workers, critical infrastructure workers, people who work at power plants. It's a little bit like right now, as the state was trying to decide where to draw the line for people with serious health conditions. There are a lot of health conditions listed that can give you a less positive outcome, or a worse outcome, I should say, from COVID. In Ohio, if you start adding up people with a BMI over 35, people who have diabetes, people who have heart disease, people who have emphysema or asthma, down the list, you end up with about 60% of the population. People that have cancer, you know, you end up not prioritizing anyone. And so I think the state's really trying to take the approach, if they did take that entire CDC list and have all those people prioritized, it would really not be a priority list at all. So this is the beginning of this vaccine effort. We're going to be doing this for well into the fall. This is not an 8-week process. This is an 8 or 10 or 12-month process. And Dr. Moeller maybe can comment. There's some thinking that this may be, even much like a flu shot, maybe something that you'll have to do, you know, annually or certainly periodically. So this is the beginning. Like I said, the state has not even determined what 1C will look like. But really, that's what it comes down to, Teresa, is to call it a priority. You need to be so limited to truly make it a priority. And then slowly they're going to be adding to those groups over time. But really, the elderly and those with severe disabilities were the most important in that 1B population, along with getting kids back in school.
Thanks, Andy. And again, the higher education question, some other states are doing it differently. I know that a lot of concern around public safety and police. They're not in the priority group yet in Ohio. So there's lots of conversations and push on these issues. So let's stay tuned. I think there'll be lots of attention in the media, but clearly the university is going to be paying attention to those that would impact those in our Buckeye community. So thank you for that. And actually, let me turn to, you mentioned Dr. Moeller, and I'm hoping that, let's start that. He'll probably respond to the question that you kind of posed, Andy. But one of the most common questions beyond what we've just done is about the vaccines themselves. And Dr. Paz did speak to this, but again, Dr. Moeller, could you speak a bit about the vaccines and both the record pace at which they were developed? The question really is, are they safe? Are they safe and are they effective?
Really, really great question. So maybe a couple statements is I would say science has never been more important in our lifetime as it is today. And I would also add to that to say Ohio State has never been as important as it is today. And I say that in the way that we're leading a lot of the efforts and have clear line of sight into what's happening in our world of healthcare, in vaccine development, in testing, in epidemiology, and about 63 other different things that President Johnson could probably mention. Because of that line of sight, we have had unprecedented visualization of how the process works. And we'll tell you, and going to be very important for all the Buckeyes out there, for you to be ambassadors of why this vaccine is safe. There are a lot of people out there that have big questions and really important questions that we need to talk about data with. When these vaccines were developed, they were developed with record pace. As Dr. Paz mentioned earlier, there's a number of different processes that a vaccine or any therapeutic has to go through. All of those were done at record levels in terms of the number of patients that were recruited to these trials and the amount of rigor that went into these. And in fact, we can remember even from this summer, some of these vaccine trials were stopped because of some safety concerns that were later resolved. So 70,000 different people were included in the first mRNA vaccine trials that were developed. A high number, a high percent of people from underrepresented groups were involved in a lot of these processes. And in all cases, for the vaccines that are developed and the vaccines that have been tested, they've gone through this incredible level of rigor. And while we have seen some minor phenotypes or some minor things where you might get a headache, you might get fever, you might get soreness at the site of injection, we have very good line of sight that to date, that these vaccines are very safe. It's very important, though, that all of us in Buckeye Nation get the data to talk to people. There's a lot of people out there that we really need to reach with this information to talk a little bit about the safety of the vaccines. And as the new vaccines come on the market, to understand how these vaccines are different. So it's not just saying they're safe or they're not safe. It's, as Buckeyes, why are they safe? Why do we have faith in the process? Why do we have faith that this is going to be a cure for what's going on?
Okay, well, there will continue to be questions, but that's really helpful to hear for sure. So let's take a slight pivot because everyone's asking it, and I'm seeing it come up through the Q&A quite a bit. And that really has to do with the variants, the new variants that are being talked about, whether it's the UK variant, the South African variant, the Brazil variant. What does that mean for the vaccine as well as for managing the pandemic overall?
Sure.
Vaccine and the vaccination status.
Yeah, another really great questions. And again, I'm going to go back to data and starting with data. It's important to understand how these vaccines were developed. When we think about the virus, we talk a lot about this spike protein. The spike protein is not one residue or one mutation. It's about 12 to 1,300 of these pieces of amino acids that all come together to form a large piece. So when we think about a mutation or a variant, that's 1 out of 1,300. And I want all of us in sort of Buckeye world to think a little bit about Velcro. And this is how we visualize it at the medical center, is that if you have two pieces of Velcro that are sticking together and there's 1,300 of these little strands that form the bond, imagine what happens when you take one of those out. Certainly becomes weaker, but it still works. And so when we designed the vaccines, we designed it knowing that viruses change, viruses evolve. This is something that we've known for many, many years. And so when we designed the vaccine, we designed it to hit multiple sites. And while we are keeping a line of sight into these changes or these variations in the virus that may eventually impact it, or you might get a booster, or you might get redesign of some of these each year when we design the vaccines, we still know that the vaccines are very effective, but it's something that we want to keep our eyes on as these viruses continue to mutate.
Right. Really important. So I appreciate that. And I think from a public health perspective, let me turn to Dr. Fairchild to just give us a sense of that and actually what it might mean for kind of the overall management of the pandemic. So Dr. Fairchild, there you are.
Thank you. Thanks, Teresa. Well, so certainly from a public health perspective, it's a concern. And it doesn't necessarily mean, you've heard the CDC projections that the UK variant is likely to be the dominant variant by the end of March. This doesn't necessarily mean that we're going to see another massive surge in cases. Already we see the curve going down, and it's going down due to a mix of factors: prior infections, the end of the holiday season, and of course, vaccine rollout. If the variant does take hold, it could either mean, as we've heard, faster transmission or some kind of reduction in the ability of the vaccines to both vaccination immunity and natural immunity to protect us. So we could end up seeing a longer plateau in terms of the level we see cases at a relative, the length of time we see cases at a relatively high level. We could see pockets of infection or small surges that we wouldn't otherwise experience. But it all comes back to this notion, and everybody has hit home on it, that this means that we need to be vigilant about the many layers of protection that we do have. I think it's important, and you hear people in public health talking about this all the time. The vaccination doesn't replace all of these other layers, at least in this stage of the epidemic. It's another powerful, important layer that's effective in preventing symptomatic disease. And that's going to be part of the solution to ultimately bringing the virus, the pandemic, to extinction. But these measures do work. Masking, especially if you wear your mask correctly, and if you see somebody wearing a mask under the nose, I invite you to remind them that it's not effective unless it's above their nose. It needs to be tightly fitting. We need to engage in hand hygiene. We need to keep engaging in physical distancing. So it's something that we're watching from the perspective of the comprehensive monitoring team, we are going to have the capability through the Applied Microbiology Service Lab to be sequencing samples on campus, but the emergence of variants doesn't mean that all of this comprehensive plan we have in place, testing, isolation, quarantine, masking, distancing, that still works.
Very good. I appreciate all of this is so important, and we're getting lots of questions that relate to that. And actually, we're getting hundreds of questions. So very good. Let me stick with this notion, Amy, or Dr. Fairchild, my apologies, Dr. Fairchild, about what the post-vaccine life might look like here on campus. Are those, and maybe how long it might take us to get to this different place, but are those who are already vaccinated or will soon be vaccinated, will they be able to stop wearing masks, which I think you've spoken to, but I just think we need to keep reiterating. And do students who've been vaccinated, will they need to keep being tested as we move into this vaccination or post-vaccination era?
Thank you, Dr. Long. And I called you Teresa, so you can call me Amy, that's for sure. So the short answer is, and I know it's not the answer that anybody wants to hear, because we're tired of wearing masks. I'm tired of wearing a mask. I'm tired of keeping my distance. But the answer is yes to all of those questions. Until we're confident that we've largely extinguished the epidemic, we're going to need to keep all of these critical layers in place. So again, the virus protects you from severe illness from COVID-19, and that's a compelling reason to get vaccinated.
Wait, the vaccine protects you.
The vaccine protects you from severe illness from COVID-19. And that's a really compelling reason to get vaccinated. It's going to help you, and it's going to reduce the burden on our hospital system and in society. Now, we may be able to say with certainty at some point that the vaccine has an impact on getting infected and on transmitting it to other people, but it's just too early to know. And until we know, we need to promote vaccination for what it is. It's another powerful layer in a comprehensive strategy that includes testing, contact tracing, isolation, quarantine, distancing, and hand hygiene. And it could be at some point, and we have our modelers working on this, it could be that we will get the information that we need in order to reduce the cadence of testing for people who get vaccinated. And that too would be a powerful incentive to get vaccinated.
I appreciate that. We were in conversations earlier today thinking about vaccine euphoria, and we're not quite there yet for sure, but this vaccine is so important in us moving forward. So we really want everyone's questions to get answered. With that, actually, I would have called us to a close, but all the various panelists, but President Johnson has suggested that we might go over at least with one or two more. And again, all of your questions that are coming in, we will put them into a response grouping, and we will share those on the website and get that out to you, and you will learn about that. So all of your questions will get an answer. Maybe not individually, because there are many, but certainly in groups, and the topics will all be addressed. So let me turn to a couple others that have just come in. One is about, and actually, I'm going to go to maybe the last question first, but come to this. Andy, there have been numerous questions about the ODH guidelines. And so I kind of hate to beat that again, but if you could just go over the vaccine guidelines that we are currently dealing with. We know that there's still many to come, but the 1A, but really the 1B, and who is in that?
So just to reiterate, the 1A population was focused on three groups: people that live in nursing facilities or congregate care. So think assisted living, think nursing homes, the staff and the residents, EMS workers, and then hospital staff that provide care to patients. And the state has now further clearly defined that as individuals who provide care for COVID patients or immune compromised patients. 1B populations, which just started 2 weeks ago with vaccination, also three groups: elderly over age 65. They started with 80 and over 2 weeks ago. Last week was 75 to 79. This week is 70 to 74. and next week is 65 to 69 becomes eligible. That's group one, or folks over age 65, and that kind of incremental approach. The second group are individuals that have a significant disability and this is, when I say significant disability, I mean you have a case open with the Ohio Department of Developmental Disabilities. That's a specific, subset of disabilities that the state has defined as severe congenital or neurological impairment and disability. And for the first 2 weeks of that window, from last week, or the first 3 weeks, I should say, of that window till February 15th, are individuals that are actually mainly getting vaccinated through Nationwide Children's Hospital because there are in many cases already patients there or have been patients there. But that's being completely coordinated by the county boards of developmental disability. Now, after February 15th, we'll move into, instead of disabled and with one of the lists of the health conditions that's on the ODH website, I actually just put those in the chat for someone who had a question. I listed out those conditions. As of February 15th, it will be disabled or have one of those conditions. So that's when it'll be a broader populations of individuals like sickle cell disease, thalassemia, diabetes requiring admission to the hospital in the past year for your diabetes, congenital heart disease requiring admission over the past year. So that it will expand solid transplant, organ transplant patients. That's when it will expand after the 15th of February to a larger group of individuals. And then the third group in 1B are K through 12 teachers and staff that are student facing. And that goal is to get students back in the classroom. So any school district that's been given vouchers to give to their staff has given a written commitment to the state that they will be back in in-person session, either hybrid or full by March 1st. Obviously, if teachers are just starting to get vaccinated this week, they will not have their second doses in place by then. But obviously, each of those schools is expected, much like we've been describing here, if we were able to have the campus vaccinated over time, you're not going to have everyone vaccinated on day one. Those K through 12 schools are still going to need to have all of those public health interventions with distancing, masking, hand hygiene. The K through 12 schools are going to need to have all those in place when they go back into the in-person setting this spring. So Teresa, any other ways that you'd like me to clarify that?
No, that's really helpful, Andy. And I just think we all keep trying to get our heads around it, both when can that's obviously one, our family members, loved ones, neighbors, et cetera. When can we help them understand that their turn is now?
Yeah, I think, certainly like I said, the state has not yet determined where it will go with 1C, whether it will do other groups of essential workers, whether it will use an age approach. If you look at the state data, if you take patients over age 50 that have had COVID, it represents like nearly 99% of all the mortalities in the state. So that would be certainly one way to approach this, would be looking at 50 and older. And I think there are, if anyone saw the Dispatch this weekend, there was a big story on the fact that morticians undertakers feel that they also need to be vaccinated. I've heard folks at the state say they've gotten letters from, you can imagine the list of professional organizations from different groups making the case for their workers. And I think the university community, the higher education community, has certainly been at the table, voicing their interest in having our folks be accounted for in that as well. But the state has difficult choices to make, and they've, like I said, not announced really whether they'll do more in age, or whether they'll do more health conditions, or whether they'll do more essential worker type categories.
That's really helpful. And don't go far, because there's two other questions. And again, I know we're over time, but I'm committed to pulling this in quickly, but these are really ones that, again, multiple people have asked. So let me stick with and they're both about vaccine and the distribution thereof. So Amy, Dr. Fairchild, so can you speak a little bit about, are there ways that we should think about this scarce resource? Because it is a scarce resource, and you're an ethicist. Are there ways that we should think about how the fair, equitable distribution? There are questions coming in about that. Can you help us?
I sure can. And this is a moment where I would remind us that as much as we're thinking about ourselves and our families at this moment in time, we have to think about our mission as a land grant institution. And it's super important to remember that this is a moment in which demand exceeds supply. So we really need to think about the likelihood, who's really at high likelihood of exposure to COVID-19. And remember too, that that this campus is a really safe place. Our classrooms are really safe places when it comes to transmission, provided we have all these layers of protection in place. And we need to think about the likelihood of negative outcomes and death if someone is infected. So I'm not someone who's in a high risk group, and I'm comfortable waiting for vaccination because I'm sticking to all those layers of protection. I really believe that they're effective. I've seen the evidence, and I'm the norm in our population. And I think above all, we need to remember that in Ohio and across the nation, some communities are experiencing disproportionate rates of infection, complicated, and death. African American communities in Ohio. And we have to prioritize these hard hit communities and consider all of the barriers that they have to vaccination, transportation issues, that some of our essential workers don't have the same capability that I would have to sit in and check email all the time to see when my number's up. So in sum, I would say, as a community, as a land grant institution, we also have an obligation to make sure that the rollout mirrors the pattern of death in the state. And we have a ways to go on this front.
Well, thank you for that. And both there's eagerness, but we also need to hold ourselves back and be sure that those who have the greatest risk, but also have the need, that we can support them in getting the vaccine as soon as possible. So the last question that I'm going to pose tonight is actually one that's come up a couple of times. And I think it's to Andy, but there may be others who would like to weigh in. And the question is about mandating vaccine. Would the university ever, for either some groups or several groups, consider mandating a vaccine requirement? So Andy, do you want to start with that? And of course, anybody else can weigh in.
I'd be happy to. I was actually just typing one of the responses into one of the questions on this, so I'll just answer. No, I think the short answer to that question is no. There are no plans to have the COVID vaccine be required. I think that we all believe the vaccine is safe. We believe it's effective. We certainly strongly encourage people to get it as soon as they become eligible to get the vaccine. Obviously, there are a wide range of beliefs and questions and doubts, and we're doing our best, both in the lay press, in the medical literature, in whatever way we can, to have our faculty and staff out in the forefront, working with not just the medical community, but communities all through Central Ohio. We've participated in task force meetings with a number of individuals from the mayor's office that work in community neighborhoods. We've worked with groups of African-American clergy. We've really, I think, done our best to engage with the community and have these discussions. I've done webinars with school districts. I've done all sorts of things that we've done to try, and we've done now, I believe, 8 different webinars with different corporate audiences, helping them understand how it's safe for them to get their workers back into the office. And then now we are talking about vaccines with them as well. So it is certainly something we strongly encourage, but I don't envision at any point in time that it will be required. And some of that's just from a practical perspective, because obviously there's no way we could do that now given the supply issues. But I think even over time, it's not something that we've taken the approach of. Even at the medical center for the flu shot, there is the ability for a staff member to opt out of getting the flu shot, but then during flu season, they have to wear a mask when they're at work, just like what we're all doing now 7 days a week. But that's actually been our process, because obviously there's some people who have allergies, have other, other reasons from a religious perspective where they may not be able to get a certain particular vaccine. And we've always made accommodations for that and found a safety way around that. So I don't envision a time at all where we would have a requirement. I don't know if the provost or Dr. Paz want to comment on that as well. But.
Well, I would just echo what you said, Andy, and absolutely, we're going to follow what is currently both state and federal guidelines around vaccinations. And I just want to underscore something because it's easy to lose sight of it. First and foremost, and Amy Fairchild reflected on this vaccine, and I don't care if it's 95% effective or it's 65% effective, the first and foremost point of this entire vaccination is to keep people from dying. We've had coronaviruses floating around as long as anyone can ever measure. 15% of all colds are caused by a coronavirus. This one is different because it kills people. And this was just reported in the media. In total, 75,000 people have received one of those 5 vaccines I mentioned earlier. And it is estimated right now that not a single person died who received the vaccine. Did a few of them get hospitalized? Yes. Do we expect that some people will get sick from this virus even after we've achieved herd immunity and almost everyone is vaccinated? Yes. But if we can prevent unnecessary deaths and we can reduce this to what is like the common cold, that in my mind is what this is really all about. And we shouldn't lose sight of that fact. So yes, we're not going to require it based on what we understand from public and federal state laws. But on the other hand, everyone, when it's their time, must get this vaccine. I truly believe that, unless they have a reason why they can't.
Well, Dr. Paz, thank you for that. And I think you've both done a good job of balancing both the eagerness and in some case the must, as you said, must get this to protect themselves and prevent serious disease, but also appreciation of the hesitancy. And we know that there has been vaccine hesitancy on many vaccines, but clearly in this one, we're seeing it as well. So we need to support whether they're our colleagues, our employees, our friends, and our neighbors, and those we don't know, as far as helping them along the way when their opportunity comes forward to be able to understand, have the information they need to make a healthy choice for themselves. And I hope that includes getting the vaccine. So thank you for that. So I would, at this point, just want to thank everyone for being here tonight. You've been amazing. Our speakers and our panelists have provided a wealth of information, and our audience, you have been super engaged. We've been getting lots and lots of questions in. And so again, thank you so much for being here. I would also say that there were so many questions, both ahead of time and during our chat tonight, that we were not able to answer. That again, a reminder that we will be writing up answers to those frequently asked questions by topic area and getting those onto the Safe and Healthy Buckeye website. And again, when they're available, that will come out and you will see that in your news in the on-campus newsletters. I would also encourage you just to keep paying attention to that Safe and Healthy Buckeye website. It's amazing, and it's being constantly updated with the latest information and guidance. So even if you've seen it before or see it like me, a regular, there is always something new and something interesting to take a look at. It's your one-stop shop for information, the best information about what's the university's response to this COVID pandemic. The university, as President Johnson mentioned, is also going to host at least two additional COVID-19 town halls. So mark your calendars. It was mentioned, but again, they are Monday, March the 1st and Monday, April the 5th. Details, including the areas of focus, the actual time and registration information, that'll come in a little bit. So again, thank you all for being here tonight to learn more about how we all can continue to work together, both to keep ourselves healthy and safe, but to keep our campus and to keep our communities safe and healthy. And with that, stay safe and have a good rest of the evening.